Hello, I'm Dr. Maury Markman from City of Hope. I'd like to present briefly a very interesting analysis, I think open to interpretation and clearly follow-up of what I'm going to discuss is necessary. But I think it makes a number of important points relative to the question, optimal utilization of multi-panel molecular testing as we move forward in this very exciting world of targeted therapy. The paper is entitled Utilization and Outcomes, a multigene panel testing in patients with pancreatic ductal adenocarcinoma. What this analysis was looking at here, again, specifically at pancreas cancer, and data that comes from Mayo Clinic analysis, Mayo Clinic, both in Rochester, Arizona, and in Florida. And they were looking at the utilization of multi-panel testing specifically in a population of 533 patients with pancreas cancer before and after guideline recommendations from NCCN that suggested such testing in pancreatic cancer. Again, one of the advantages of the Mayo Clinic system is, of course, it's the groups work very closely together. They have a really robust database. One would not know if the information in this report is comparable to other organizations, but I think it's very provocative to look at and for organizations to ask themselves, how did we do or how are we doing with such testing? So again, in these 533 patients, 60% that they look at in terms of the question of testing were before the NCCN recommendations, 321 patients. And 40% of the patients, or 212, they looked at whether the testing was performed or a discussion was held with the patients and then testing performed. Again, looking at the electronic medical record after the recommendations. And here's what they found. If you were looking at prior to the NCCN recommendations, again, the doctors making their decisions based upon their knowledge of the field, what they had read, meeting information, CME programs. 34% of the patients had had a documented discussion regarding this testing, of whom 81%, that's 81% of the population of the discussion, had the test actually performed. Post NCCN recommendation for the testing, that number increased minimally to 39%, of whom 75% of that population had the testing. So NCCN recommendations, still only 40% of the patients had a discussion of the testing at the Mayo Clinic. They noted, and this is important, that on the patients who did have testing, 17% had pathologic variants identified, of whom overall 11%, 1 out of 10, had documented prostate cancer-related abnormalities that are potentially quite relevant for their treatment and also for discussions with their family. Very important paper, very important, you might say, baseline. One must ask, how are we doing today? The implications of such testing are only greater compared to a year or 2 years ago, both in terms of therapy and, of course, discussions with the family. Interesting analysis, important analysis. One can conclude this is not so bad considering it's new. Or you could say is we wished it would have been higher. I'd love to see a follow-up from Mayo Clinic. Where are they in 2024, 2025? And I thank you for your attention.